everyone, and welcome to our YouTube channel. Today, I decided to invite a very interesting guest, and we're going to speak about equally interesting topics. So today, I have with me Peter Roberts, who is a scientist by background. And in fact, we have been using his skincare that he developed for many years successfully in my clinic and achieve some fantastic result and transform not just skin, but life of so many patients. So Peter have background in biochemistry and microbiology, and he also teach skincare science at University of Yukon to many medical professionals in the UK. Hi, Peter.
Hi Ola, how are you?
I'm good, and you?
Yeah, good, thank you. Nice to see you again.
Nice to see you too, and thank you for finding time to join me today. And as you know, I wanted to discuss this topic for a while and probably answer a lot of questions that patient and general public has about some very important skincare ingredients. What I've noticed that during pandemic, many people put their attention on their skin and they realize how important to use good quality skincare at home. And one of the most popular product appeared to be products that contains retinol. But there are so many myths around these products, and I would like you, as a professional in this field, to give the right answers. So, Peter, if you just would generally tell me what is retinol and what types of retinol available out there.
Absolutely. It is a bit of a minefield, but it can be quite easily simplified. Retinoids, which includes retinol, are vitamin A derivatives. And vitamin A receptors exist on all your skin cells, and these retinoids will attach to them and make the cell perform in different ways, either slow it down or speed it up. Now, there are different strengths of retinols, and usually the case is the more powerful the retinoid, the more side effects it may have. Because vitamin A products applied to the skin can make your skin more sensitive to sunlight, known as photosensitivity, but also they can make your skin more reactive and you might get a bit red. So there has been this constant challenge by retinoid suppliers and researchers to get the right retinol that gives you the benefit of the retinoid but minimizes the side effects. So the most powerful out there, is one called retinoic acid or tretinoin. Now that tends to be prescription strength, and but it does also have the highest level of photosensitivity and irritation, but it's very effective. There is also a version of that called isotretinoin, sometimes known as Roaccutane, which is used in acne, and that also has significant side effects. Now, both of those you wouldn't use in pregnancy because there are potential to have an effect on the unborn baby. So you have to be careful with that. Now, the next level after that is retinol, which is probably the most widely used one. It's slightly less effective than retinoic acid and has to convert to retinoic acid once it's in your skin. But it's slightly less aggressive, so it's often seen by many companies as the best balance. There's another one called Retinol, which is similar, and then another one, retinaldehyde. But as I go through this list, the strength is going down. Sorry, the strength is reducing, but also the side effects are reducing. So you've got retinoic acid, then retinol, retinal, retinaldehyde, and then what are called the retinol esters, which you often get as cosmetic products like retinol palmitate. So they're the safest, but they're the weakest.
Wow, there are so many products out there, and especially, when they mixed with other ingredients, it could be very confusing for the patient to choose the right one. And sometimes I have patients who come to me and they said, I have been using retinols for many years. and I have no effect. And then other patient come and they say, I bought something with retinol, but it was completely wrong for my skin. So my next question is, how do we choose the right retinol?
Yes, and that's where the skill of a practitioner like yourself comes in, because by knowing your clients and being constantly involved in assessing clients, you can see, you can work out, say, well, I think you should go down that line for that retinol. But it is very much about efficacy versus side effects. So what can the patient tolerate? Do they have a sensitive skin, a reactive skin, or a dry skin? Because in all those cases, the retinol may have slightly more surface irritation effects. So ideally, you want the most effective with the minimum side effects. And it was only recently we brought out a product called Retimitate, which actually has the efficacy of retinoic acid, as in the most powerful one, but its side effect profile is minimal. It's like one of the cosmetic ones. So we think we've broken the mold with Retimitate. We brought out a 1.5% serum, which is like a low dose of retinoic acid, and that's been so well tolerated, so well accepted, and so effective. We're actually going to bring out a 3% strength of it, which will give you even more efficacy, and the side effect profile still seems to be fabulous. So that's me being personally pushing my one. We do have also our own retinol, which is an encapsulated retinol, and the idea of that is to prevent the retinol irritating. The retinol is taken in an encapsulated form and not released until it's in your skin. So again, that's trying to reduce side effects but get you the best efficacy.
So that is you talking about your Reticap product, if I'm correct. Yeah, and from my clinical point of view, I think it's very good and effective product, and I think it's generally quite gentle on the skin. Very rare when we have patients who need a period of adaptation. Usually they all tolerate it very well.
So a 2% retinol is a clinical strength, which is what Reticap is. And we've been very pleased with its lack of side effects. But I think Retimitate is probably safer still. But either, we like both of them, and we sell a lot of both of them. So.
Well, I haven't tried the other one that you just recently introduced. Which one is that, Peter?
This is the new one, which is my own formula.
Oh, sorry, Skin Vital, absolutely. Sorry, I didn't realize that you're talking about Skin Vital. Of course, yes.
So we have the vitamin C version, which you probably
know. And vitamin A.
And this is the new molecule Retimitate.
Yes.
It imitates retinoic acid, hence Retimitate.
So again, we quite like this serum, and very interesting. Some patients specifically ask about Skin Vital serum. Mm-hmm. So it's certainly new, but already have a good reputation. Peter, just my next question then is, we spoke about adaptation and side effects. So what should we do, what patients should do if they have side effect to the retinol, and especially if they bought this retinol not from the practitioner but online? Because if they bought it from practitioner, obviously they will contact the clinic, and clinic can help them to deal with the side effect. But we know there are many people out there who do their own research, buy products, sometimes without any research, and then they have not always nice outcomes. So what if you are using retinol at home and woke up one day and your face is red, sore, patchy? What should you do?
Yeah, so, I mean, the guide is stick to what your practitioner tells you to do. And I always advise you not to just do your own research, but talk to somebody like yourself who knows how retinols can benefit and also might react. In the early days, you normally would only use the retinoid at night, and you would use it probably once every other day. If you don't get a reaction in the first 24, 48 hours, you may then increase it to once a day. If you do get some irritation, it can be just a bit of flushing, which over 2 or 3 days might go down. But if the skin becomes irritable and red, then you would stop using it and go back and talk to your practitioner. But if you've sourced it yourself, yeah, you want to be careful that if you're reactive and that makes you more sensitive to sunlight, particularly at this time of year, then those problems could be quite long term. So it's go slowly, go carefully, and ideally, there are a lot of different products on the market, some better than others. Ours are medical strength, and we only sell them to medically led clinics. So because we know that our practitioners understand how to get the best use from them.
Is there any products that you can use on the skin to help to settle down retinol reaction? And especially, obviously, from your skincare range, is anything that could help to kind of at least relieve the discomfort?
Yeah, so retinoids will help with anti-aging because they improve cellular function. They can help to slow down excess pigmentation, so they work in that area. They also work in acne, and they can actually help to make a skin less reactive. But if you are having a bit of reactivity, then the first thing is to have an excellent UV. With retinols, you should always follow up their application. If you're using it at night, I would still use a UV high factor in the morning. We have our factor 50s and factor 30s, the UV Soothe, which is a calming, soothing one. So the UV Soothe is probably best because that can also help reduce any redness as well as protect you from the UV. If you are getting significant redness, we do have our post-laser care cream, which can help to reduce irritation much quicker. But they're the two that we would focus on. The other thing is hydration. If your skin is getting dry, then you may need to help to sustain the lipids and oils in the skin to keep your skin well hydrated. And the product we recommend for that is CeraBoost. I mean, something like 50% of the fats and oils in the surface of your skin are made from these molecules called ceramides, and our ceramide cream replenishes those. But they're the three that I would focus on. So it's hydration, UV protection, and controlling irritation.
Well, Peter, you know what? I'm really enjoying our conversation because I'm reflecting on what we do in the clinic, and I'm so pleased that our protocol are spot on, up to date. So it's just also reassuring. So the other question that I wanted to ask you is, so how long a patient should expect to use retinol before they will see a result? Because we know sometimes people want to see a result yesterday, but some patients have absolutely realistic expectation, but they also need to know how long do they need to use it before the changes in their skin become noticeable.
The simple answer would be, don't believe these people who say, I benefited in 14 days. What you're probably seeing then is just an improvement in surface moisturization, etc. To get real benefits from retinoids, whether it's in acne or aging or whatever, it's 1 to 3 months. So if you're not getting a result after 2 months, that doesn't mean to say you're not going to. But I would say 6 weeks in, most people will see a benefit if they're using the right retinol for their skin.
And what skin types will benefit the most from retinol, or what skin condition would be having the most impact from retinol treatment?
So retinoids, as I say, these vitamin A derivatives, they optimize skin cell performance. So if you're making too much skin and your skin's getting thicker, it'll slow it down. If you're making too much pigmentation, it'll slow down those cells. If your skin cells, which help to control collagen production, as in the fibers that prevent you getting wrinkles, etc., if they're going too slow, it can speed them up. So it stabilizes and optimizes. So in terms of different skin conditions, they work across the whole spectrum of skin types. Obviously, the darker skin types, maybe if they do have an irritating retinol, that could excite pigmentation. They might get some inflammatory pigmentation. It's rare, but need to be careful of it. And in the lighter Fitzpatrick types or skin types like mine, my background's Welsh and Scottish, so I tend to burn in the sun. Then if I get the wrong retinol, that make me go red and make me more sensitive to the sun. But if you're getting the right one and you work with your practitioner, that shouldn't be a problem. So you can use them across the range as long as you do it with a professional.
Is there any skin type or any skin condition where retinol will be contraindicated? Is anyone who can't use it at all?
So reactive skin conditions, which would include active rosacea, and we've got, it's well known rosacea is most often seen in lighter skin types. So people with Celtic skin types or Scandinavian skin types, they are prone to being reactive in the sun. So if they've got active rosacea, which is irritating, then the retinols could exacerbate that and make it more irritable. That's the main group I'd be wary of. If you have active eczema, then also if you've got irritated skin. So if you've got an irritating skin condition, ideally you want to get that under control and then introduce the retinol, because that can help in the long term for both rosacea and eczema. But I wouldn't treat active eczema and rosacea with a retinol. I'd get that under control first. And I know we're going to come on to rosacea later.
Well, Peter, I think all the answers that you gave today has been so thorough, but also I think a lot of them has been leading to a message that patient needs to go to experience clinic and receive professional advice rather than just trying to do research themselves and find something out of the internet or just at the retail shop. Am I right?
Yeah, absolutely. I mean, we only sell our medical level, and what I can say about our retinols is more than most of the guys on the internet can say. Well, all of the guys on the internet, because we've done the clinical trials, we've done the tests, we've done the safety and the efficacy studies, and it is important that you get the right product, and it is very much you get what you pay for. So if you see something that's £10 on the internet, I'd be wary of it. Because the other thing about retinols, they've got to get in the skin. And a lot of the technology we employ, the base creams are designed to maximize the absorption. And by maximizing absorption, you increase the effect and you reduce the side effects. A lot of the cheaper creams, they just sit on the surface and irritate your skin. So yes, I agree with you.
Well, thank you very much. And guys, I hope you enjoy watching our conversation with Peter. And if you have any questions about retinol, please get in touch and we will be more than happy to give you advice. Our consultations is free and you will get much thorough recommendation rather than trying to do research yourself on the internet. I hope you enjoy watching this. Thank you very much, Peter.
Thank you, Ola. Good to talk to you.